Kajala Medical presents COVID-19 The Answers, the show that delivers the scientific, evidence-based knowledge that can safely return us all to our pre-COVID lives. My name is Dr. Fumi Okanola, and I'll be hosting the show. Every week, you can listen to me interview a highly respected professional about the science that can reduce your risk of becoming infected with this coronavirus. Welcome to COVID-19 The Answers. I'd like to introduce you all to Mr. David Morley, President and CEO of UNICEF Canada. He is a prolific international speaker, commentator, human rights advocate and mobilizer with more than 30 years of experience advancing children's rights and sustainable development on the world stage. David has occupied senior positions in some of the world's most respected charities. He has been the Executive Director of Médecins Sans Frontières, Canada, President and CEO of Save the Children, and now, for the past 11 years, President and CEO of UNICEF Canada. Welcome. The World Health Organization has a strategy to achieve global COVID-19 vaccination of 40% of the population in every country by the end of 2022 and 70% by the middle of 2023. David, could you please tell the audience about COVID-19 Vaccines Global Access Facility, or COVAX, and UNICEF's role, and whether you think the World Health Organization's strategy is achievable?
I'm an optimist. So I'll explain a bit about how it works, but if we're able to get the funding, I think we have the elements in place to be able to hit those targets. I am an optimist, though. But the way COVAX has worked is that the World Health Organization, Gavi, the Global Alliance for Vaccines Initiative, and CEPI, which is also involved in vaccines, have come together to they were putting out a lot of the tenders, a lot of the ways to try and get vaccines developed, right? And this came together right as a coalition right at the beginning of the pandemic, before there were any vaccines, still against COVID, and those three organizations right away turned to UNICEF. Because UNICEF has developed over the existence of our organization the infrastructure that the world needs to be able to deliver vaccines. Before the pandemic, we procured and delivered almost half of the vaccines that vaccinated almost half of the world's children. Wow. So in an average year, we would be sending out at least 1 billion vaccines for the routine childhood immunization. In fact, until about maybe 8 years ago, we actually were vaccinating more than half of the world's children, but then the government of India started doing it themselves, and that's a lot of children. But still, it's about 45% of the world's children that we would vaccinate every year. So we had the infrastructure. We know the capabilities of ministries of health. We know where the bottlenecks are in a system. We know who's got a good cold chain to keep the vaccines cold. And our colleagues know how do you get vaccines through customs with a minimum of problems. Our colleagues know the components, how to get, because you got the vial with the vaccine in it, but then there's the syringes and the safety boxes and everything else you need to pull together. So that's a huge part for routine childhood immunization that UNICEF does. So as the World Health Organization was starting to think about this, well, we were the natural implementing agency for this. So we're working together to make that happen. We haven't. How I am optimistic is that the issue we've come so far. When you think 2 years ago, we didn't even know what COVID is. A year ago, we delivered the first vaccines through COVAX, reached Ghana. It was the first country in the world to get some. They got them in February of last year, and now many of the bottlenecks have been overcome. Not all of them, but many. And so I think that if the money is there, we have the system that can make it work. And it's an extremely, one of the biggest things we had to do in working with ministries of health and in training with community health workers was vaccine hesitancy, and the difference of giving the vaccines to adults as opposed to children. And I think we've seen that in Canada, the distribution for the organization that we had to do here to be able to vaccinate adults as opposed to the routine immunization for children. It's different. And adults well, sometimes they don't want to get vaccinated in a certain way, or they're babies too. They don't want to get this type. Not babies can take their vaccines better than adults do often. So there's training that we have to do in many countries. So we put a lot of those building blocks in place, and now it's ramping it up further.
Drawing from a commentary titled Vaccine Apartheid, Global Cooperation and Equity, published in The Lancet in February 2022, I quote, "An open letter to G20 leaders in October 2021 highlighted how 133 doses per 100 people have been given in high-income countries, compared with 4 doses per 100 people in low-income countries. The World Health Organization Director General has called the divide a vaccine apartheid, speaking beyond the phrase vaccine inequity, to emphasize the scope of this moral failure and make explicit comparisons to the South African system of institutionalized racial segregation." David, UNICEF did a fantastic job with many obstacles by delivering 1 billion COVID vaccine doses to 144 countries by the end of December 2021. Truly amazing. The original target was 2 billion doses. So what were the factors, in your opinion, that impacted the shortfall of the original target? What additional assistance would UNICEF need to deliver a larger volume of doses?
Well, I think, that what you quoted from the Lancet is the reason we didn't hit our target at first. But there are elements within that. First of all, it was ramping up production. There were, and I remember there was, for one of the brands ran into difficulty with a factory. I think it was in Baltimore, and so suddenly the U.S., which was going to be, they had to scramble to do that. So there was, after the vaccines had been invented, it was getting production high enough, and then absolutely, wealthy countries outbid others to get those vaccines, and but we now, what I have heard from some of our colleagues who are close to this is that the issue is not there will be a sufficient supply. Maybe there already is. So it's no longer supply that's an issue. It's and to reach some of the low-income countries that that this is too much of a blanket statement, but it's relatively true, have less robust health systems. Middle income countries tend to have slightly more robust health systems. So it's making sure that things like the cold chain, and that there's a sufficient all the supplies that we need to go out, because the Lancet was saying in October of last year it was 4 doses per 100. The most recent I've heard is now it's 10 doses per 100 in low-income countries. So it's not good enough. Please, no, I'm not saying that it's good enough, but I do think that the numbers keep moving, and I think we'll be able to keep the speed on its way, I think. But you know what? I'll tell you, there are 2 things that really concern me about how we will keep that speed up. One is when people in the wealthiest countries, the high income countries like ours here in Canada or in the UK, when we have many of our leaders saying, okay, the pandemic's over, well, maybe it feels that it's over for those of us who are middle class Canadians, but it's not over. But because if we think it's over, then maybe we'll forget, and the political support for helping other countries will decline, and so that will be less likely. And my other fear is that as a species, it seems we can only keep one thing in our mind at a time. And with the war in Ukraine, that is, which is horrific. And I mean, it's horrific. But it may be the combination of the war in Ukraine and that things are opening up in the OECD countries. We're going to forget about the rest of the world, and of course that's horrible for the people who are suffering, the countries and economies which are still shaking. But also it's foolish because we know that low vaccination rates are going to mean more opportunities for more variants, and in our own self-interest, it's foolish, let alone for the fact that it's morally repugnant.
Well said. And politicians can go on and on about the pandemic being over, but the evidence is all pointing to the fact that it isn't. We may well be done with this virus, but this virus is not done with us yet. And I think that attitude will poke us in the eye in the very short distance future, frankly.
Yeah.
Vaccines in low and middle income countries are in short supply, and adults are being prioritised for COVID vaccination. Bearing in mind that children in low and middle income countries have had more severe cases and deaths from COVID-19 due to poverty, poor nutrition, higher rates of pre-existing illness, can we reshape this narrative to allow more children to be vaccinated in lower and middle income countries, yet balance with COVID vaccinating adults to avoid children being orphaned?
You mentioned earlier about the impact of poor nutrition on health and on opportunities for child survival, and I think this is a good example of that when children are weaker, diseases are worse for those children. I think that we still need to be sure that frontline workers are all getting vaccinated and being, particularly health workers, and as I mentioned earlier, teachers. And that's where we've been we've been putting a lot of our emphasis in. So that's still, those are adult, and those are adults, but they're key adults in bringing the pandemic, and then once they're fully vaccinated, if schools can be open, and if then frontline workers, health workers can be community health workers, what are the vaccines that we are going to be able to get into countries first? So if it's going to be adult or adolescent or pediatric formulations, if it's for adults, so that will I think that still needs to be the priority, is figuring out, and it will be physicians like you and your counterparts in countries around the world who will decide in those ministries who are the most vulnerable, and starting with the most vulnerable and working our way that way, sort of as we have here. It's imperfect, but I think it's the best way for us to approach how to move forward on this.
Okay, thank you. And another question in that topic, COVID vaccination of children has not been a global success story, regardless of perceived economic status. Even in high-income countries, COVID vaccination is not universal. For example, the UK has been very slow to vaccinate children. In North America, there is a relatively poor uptake of COVID vaccination, particularly in the 5 to 11 year age group. What plan is COVAX developing for the COVID vaccination of children in low and middle income countries?
It's important to remember that or to be clear, because I realize I haven't been clear. Much of what we do at our colleagues in COVAX is responsive to what ministries of health are within a given country are going to want. So we're not at UNICEF, we're not the ones who are saying you should vaccinate in such and such a region or do it in such and such a way. What we're doing is providing the support, and then the Ministry of Health, and together with the World Health Organization, but the ministries are the ones who are making the decisions about who will get priority, and WHO will be saying, here's how we think you should do it. And there's I think there's a general agreement about the frontline health workers, but it's we are still globally outside of high-income countries. The issue of pediatric vaccination against COVID is again, this is probably too sweeping a statement, but we're still trying to get enough adult vaccination, all of the vulnerable adults vaccinated, and that's led by the local ministries of health. And it also and it depends when we get donations of actual doses, what kind of doses do we get as well, because we get both doses themselves donated as well as money for us to buy the kind of vaccines. So so we really want to help ministries of ensure that ministries of health, that local ownership is really what's driving this within a given country.
Right, thank you. So COVAX depends on the philanthropy of high-income countries donating vaccines. Surplus vaccine is donated once the donating country is sufficiently supplied. This does not appear to address the root causes of vaccine inequity. I've heard of various ideas to overcome this inequity, such as addressing patent rights for mRNA technology so that poorer countries can manufacture the vaccines themselves. Alternatively, I've heard of an idea of COVID vaccines that should be made in a number of smaller advanced countries with smaller populations, as there will always be a bias to vaccinate your own country first. So if the population is smaller, then they could quickly distribute to everyone else after vaccinating their own. Most manufacturing is happening in countries with large populations such as the USA, India, UK, which is possibly stalling distribution to lower middle income countries. What thoughts do you have on increasing vaccine production and equitable distribution globally?
Well, I think that, we're seeing, for instance, in South Africa, not a small country, but I do think having having the manufacturing of the vaccines in a variety of countries and regions is extremely important and will be extremely helpful. Um, if things really get further bogged down, then there are mechanisms in the World Trade Organization which might become necessary, like compulsory licensing, like waiving patent rights, and or else, and I think some places are looking to some companies who have the patents to to share the patents at a minimal or nominal fee might be what they want to do to avoid anything compulsory coming. But that would help. But it's also other. It's not. We have to remember that it's not only the vaccine itself. It's not only the vial that we always see a picture of on television. It's how do we got to be sure that we don't start having a shortage of syringes, because we need all those syringes, right? There's the special syringe, one dose, a set amount, so that you can't syringe. There has been some of my colleagues have just expressed concern that all of the supply chain stuff that goes into making those syringes, there's a risk. They're still being produced now, but that could be a concern down the road or later on this year, as well as the safety boxes and still the PPE, right? That the frontline workers need who are administering the vaccine. So I do think dispersing the manufacturing of the vaccines, but also ensuring the supply chain of the other less high tech side of making vaccination, everything you need, as I say, to turn what's the vaccine, to turn it into a vaccination that goes into somebody's arm. We've got to, I think, a decentralized manufacturing will be helpful and will allow for faster and more equitable distribution.
Thank you for that. With respect to vaccine distribution in areas where people can least afford it, former CEO of Merck, Ken Fraser, has a great quote: "The last mile challenge is the greatest." David, how is UNICEF working to overcome that last mile challenge? What else do you think needs to be done for equitable vaccine distribution? So we're talking about actually needles in arms.
Yeah, no, I love this question, because that last mile challenge is what is UNICEF and our partners, our civil society groups, NGOs, ministries of health. We're thinking about that all the time. How do you get and what we know is that if you say, I'm going to reach this village that's beyond the end, not only of the paved road, but even of the dirt road that just has paths to get to it. If that's the village we're going to reach, that it's going to make all the way along the chain from the capital city and the airport where things landed, it's going to make it all stronger. And it's a challenge. I don't want to belittle it, but goodness me, the community health workers that it's been my privilege to meet in a few different countries, and their commitment, their enthusiasm, like those folks are the heroes. I think it's the I was just talking with a friend the other day about a guy named Edward. That's why I remember, because I was talking about him the other day. I met him a few years ago in he's a community health worker in Uganda, and he just inspired me because Uganda was setting up a system where you could do report stockouts of medicine by text, by SMS, and he would say, yeah, and we have to climb up a tree to be able to get the signal, right, to send the message to into Kampala. And so yeah, it's a challenge. There's not, I mean, and I don't want to belittle it by that challenge by any way. I don't want to romanticize it, although I can assure you I feel pretty romantic about it when I think of those people who are doing so much and making such a remarkable difference. So I'm not sure that I would agree that the last mile challenge is the greatest. It's a huge challenge, but there are challenges all the way along the way. And what we have at the end, in that last mile, is people who are hungry to help, and the community health workers who give them the tools and they're going to do the job. So sometimes the challenge is maybe us in the high income countries opening our hearts enough to be able to make sure that there's to the need for vaccine equity and justice. That might be a greater challenge than that last mile.
Well said. Despite a great desire for the pandemic to be over, there is a worldwide push by governments and public health agencies to declare we have to live with the coronavirus and claiming that we're in an endemic phase. According to the evidence-based information, we are still in the middle of a pandemic and it is far from over. As you've correctly stated earlier, there will be more variants emerging, given 50% of the world's population are effectively unvaccinated, particularly if COVID vaccination is defined as a 3-dose vaccine program. What are your opinions with regards to live with the coronavirus and ending public health measures such as masking and vaccine mandates, particularly since the majority of the world's children are unvaccinated from COVID?
You know, I'm not a policymaker, and I think sometimes as we talk about the need to live with the pandemic, live with coronavirus, is because societies in high-income countries are exhausted in that huge global pandemic of the Spanish flu that in the third year, which we don't talk much about the third year of the Spanish flu. We just talk about the first two, because people were tired of the measures they had to take, and they just figured, well, I was going to have to live with it. So I think that living with the pandemic may be something that we do have to do because our societies are fed up with it. You know, it's I'm not by any means saying it's the right thing. I'm not saying, but I just think there's a collective exhaustion with this, and if that means that variants spring up because as you were saying, so few people are vaccinated, globally, then we'll be back where we were before. But I think that is living with the coronavirus statement is more a political statement than a health analysis statement.
Well said again. If we look to the future, David, we will successfully emerge from this pandemic if we manage to achieve global cooperation leading to adequate sharing and distribution of COVID vaccines, resulting in actual needle in arms with regards to COVID vaccination. Presuming we achieve this, what new landscape of worldwide healthcare access do you see for our planet? Do you think this can materialise into better resources and access to healthcare in low and middle income countries, benefiting from infrastructure created from the pandemic?
Well, despite what I've often been saying here, as I said, I'm optimistic. I'm optimistic for two reasons. One is, you know, in your question just now, you talked about global cooperation. And one thing that has been exciting for me, I must say, is the response of many tens of thousands of Canadians who've said, we need global solidarity to fix this. It's not, we need to, it's not just my neighborhood or my province or even my country. There's a recognition that the world right now, it's the only place we have to live. And so when we say charity begins at home, well, home can be South Africa, home can be Bangladesh, home, you know, or home can be Toronto or Vancouver. But that I've at a grassroots level, in so many times, it's been a wonderful sense of global solidarity as people have risen to the occasion, I believe. And I also think, you know, I mean, one example is around the ultra cold chain. In order to do the vaccination campaigns that need to happen, absolutely, we're UNICEF is working with those local ministries of health to make sure that it's not a bunch of outsiders coming in, or it's not a bunch of you know, changing all these having to impose new systems or anything. No, it's strengthening ministries of health, and it's strengthening the training of community health workers. It's strengthening those supply chains that are reaching out to that last mile. So for example, we have delivered hundreds of new ultra cold fridges to keep, and we're not taking them back afterwards. I mean, they've gone to countries along with the system in order to keep them ultra cold, and we've also upgraded the cold chain. I'm just picking the cold chain because since I'm not medical, that's one I can understand the importance of that. And we've been upgrading the physical infrastructure of clinics and all, so that to be the sub centers from which often the vaccines go out to the more rural areas, and we're doing more training. So I do think that the result from this is going to be our stronger health systems in many countries. It will be a byproduct, and a byproduct that we're trying to do on purpose. I mean, we have to address the pandemic now, and then the stronger health systems will be a way to address the issues now. But it really will leave a legacy that can be used once things are back, or a new normal, whatever we want to call it, and that'll have stronger systems that can do a better job of the routine immunization for children, that can do a better job of delivering nutrition, and that's going to make things better. So it's going to take, you know, I talked about this child survival revolution that's been stopped by the pandemic. It's not going to be today, but I do think that we'll be able to come out of that. Maybe it's going to be might take a couple of years, but we'll come out a couple more years. We'll come out stronger, and we'll be able to do more as a global society to ensure that global health is higher on the agenda, and that most importantly, from our perspective as UNICEF, that children lead healthier lives. I think that will come.
That was a fantastic statement to end this interview, David. Thank you for your contribution. UNICEF is an amazing organization, one of those who I would say are holding up the world at the moment. We are all thankful that you continue to be a great advocate and champion of children's rights.
Thank you very much.
And I'd like to really appeal to the audience to please donate to UNICEF. You've seen and heard today of the amazing work and things that they do nationally and internationally, not just for children, but for adults. So people can donate by going to the website. Is that right, David?
Yes, that's right. Yeah. And here in Canada, it's unicef.ca is where people can go to make donations and be part of our global movement to improve child health.
Excellent. And yes, and I think it's unicef.org if you're
It's the global one, and I know that you go around the world, so yeah, unicef.org is also the way. So
wonderful. And obviously those links will be provided on the show notes so people can click on and go to those directly. So please join us for next week's episode called Vaccination of the Indigenous People of Canada and the Effects of COVID-19 on the Indigenous People of Canada. Thanks for listening to this week's episode of COVID-19 The Answers. If you enjoyed the episode, please subscribe, rate and review, and do visit our website kajalamedical.com/COVID-19 The Answers.